Okay, everyone. Hope everyone's doing well today. I'm Melissa. Most of you know me. For those that don't know me, I'm the founder of Alabamians for Medical Cannabis Freedom and Disability Rights. Today is May the 12th, and it is the ninth meeting of the Alabama Medical Cannabis Commission. And this is just a regular meeting. This is not one of the specialty meetings or anything. I am going to, we had a little bit of change of plans today, so what I'm going to have to do is I'm going to have to record the meeting, and then I'll go back and watch it. That way I can close my office door and you guys won't get any background noise or anything like that. So we are about 5 minutes out, and as you can see, they are recording the meeting like they always do. So, and I have the volume up, so let me go ahead and turn it up some more so I can make sure that you guys can hear. Let's see. Let me see if I can give you guys a preview of who all is on here. Usually it lets me do this, but apparently it's not letting me. Okay, that's no big deal. Usually it'll give me a big picture. Let me see if it'll do it this way. Yeah. Okay, so this is just an idea of how many people are on watching the proceedings, and I'm going to go ahead and close it back just in case they get started a little early, because I want you guys to be able to see their screen. All right, we should be good now. Okay, so like I was saying, I'm going to record the meeting, and then after it's over with, usually it's about an hour, I will get this watched hopefully this evening, but it may be tomorrow, and I'll get notes and everything put out. And again, this is the ninth meeting. This is okay. Here we go. Yeah.
Thank all of you for being here today. If you would, please just check your cell phone and make sure it's on silent mode. If you would, we'll start with invocation. Thank you, Dr. Stokes. Y'all pray with me. Father in heaven, we thank you so much for another day of life. We thank you for this commission, our fellow members today. We thank you for our staff, for John, Daniel, Brittany, and Cindy, and Charla. And Father, we just pray for their efforts, and we thank you on our behalf as they lead and guide us. And Father, we just thank you for all the help they give us and how we do as a commission. Father, we thank you for our guests today, and we just pray that in our efforts as we move ahead, that you would lead and give us wisdom in the days ahead. Father, we just thank you for the opportunity to serve Alabama in this way. I pray in Christ's name. Amen. Amen. Thank you, Amen. Next will be our roll call by our director, Mr. John. Okay, Chairman Stokes. Thanks, Vaughn. Here. Dr. Saliski. Here. Dr. Blakemore. Present. Dwight Gamble. Here. Dr. Martin.
Here.
Dr. Jensen. Here. Gloria Skelton.
Here.
Judge Price. Here. Taylor Hatchett.
Here.
James Harwell. Here. Dr. Safarsky.
Present.
Leon Robinson.
Present.
Perfect. Thank you. Everyone's here today. Next will be approval of our minutes that we provided you via email from the April 4th meeting. We have a motion for approval or any corrections.
Motion to approve. Second.
Second. All in favor say aye.
Aye.
Ayes have it. Next will be the approval of the workshop minutes. If it's okay, I will just read the various workshops we had, and we'll have approval in mass, if that would be okay. You know, we had some workshops, and a lot of us who participated in those, and thank you for all of you for doing the time. On April 21st, certification and registration of qualified patients and registered caregivers. April 26th, applications and licensing generally. April the 27th, applications and licensing dispensaries. April the 28th, applications and licensing of subsistence transporters. May the 4th, regulation and oversight of the medical cannabis industry. May the 5th, applications and licensing of processors. Are there any changes on the minutes? If not, we have a motion for approval.
So moved.
Second. Have a motion and second. All in favor say aye. As far as opening remarks, I just want to thank everyone for participating in the workshops and our goal is to stay on schedule. It's a very aggressive schedule, but we're still working hard to stay on it. So if it was okay, we'll just go through our committee reports then, and we'll start with the dispensaries committee report by Dr. Sam Blakely.
Chairman Stokes, thank you for the floor. I'm pleased to introduce both Mr. Dean Crater, Ms. Keoki Allen, and Mrs. Kara Cronkite. Mr. Dean Crater will present first. At the University of Missouri, Mr. Crater coordinated research that supported ad hoc projects for both government and education decision makers. He developed customized research, reports, and economic models that helped decision makers in the Missouri legislature. These tools were utilized by committees for oversight, lottery, revenue, and the Department of Health and Senior Services. And then second, Ms. Keoki Allen and Mrs. Kara Cronkite will present. Mrs. Allen is the audit supervisor of the Nevada Cannabis Compliance Board. She oversees 222 dispensaries. Her and her team of specialists track data throughout the seed to sale supply chain to ensure compliance at all levels. Specifically, Mrs. Allen is skilled at auditing financial transactions at dispensaries, which helps to eliminate the diversion of cannabis products. Mrs. Allen has a thorough knowledge of seed to sale software and has provided webinar sessions regarding this topic. Mrs. Kara Cronkite is also with us today, and she serves as the Division Chief for Inspections and Audits in Nevada. Thank you, Mr. Crater, Mrs. Allen, and Mrs. Cronkite for joining us today. Mr. Crater, you now have the floor.
Mr. Crater, you're muted.
Mr. Crater, you're muted.
Thank you. Thank you. Thank you. So I met Sam a couple weeks ago on LinkedIn, and he probably Googled marijuana, or put marijuana in the box. That's probably the best way to get a hold of all of my work is to just Google me. I'm Dean Crater. Marijuana, Missouri will probably get you right to the paper that I'm going to talk about. Do we have a first slide?
So yeah, Mr. Crater,
Yeah.
I have 3 points to make with your presentation regarding your research in Missouri.
Okay.
So the first question is posted for our audience to read, and it states, after your paper was published, there were people in the state of Missouri that feared that there would be an oversupply of cannabis because the legislation amended the Constitution to have, and I quote, no fewer than 60 cultivators. With hindsight being 2020 and 4 years post the publication of your paper, what is your opinion on the supply of cannabis in the Missouri market? And is the market showing symptoms of oversupply? And why should our commission fear oversupply in the supply chain?
Okay. I think it's a robust market in Missouri. It's a flower market, which has edibles and gummies. It is basically one step away from being recreational, in my opinion. This is not the case in Alabama. there's going to be a very specific type of product in Alabama that will probably not attract big boxes, big box cannabis. I am not positive on that. There, I would not fear an oversupply of cannabis for this product, especially if it's monitored seed to sale. And I don't want to address that people may have fears of oversupply, so I don't have an opinion on that.
Okay. So moving forward to point number 2, Missouri has a population of nearly 6.2 million, and your research estimated the number of qualified patients would be around 0.3%. Other analysis estimated that the number of qualified patients would be more likely 2% of the population. First question, why should forecasts of qualified patients err on the side of the number of qualified patients being less than 2%? And second question, how did your publication affect Missouri's forecast on taxable revenue from cannabis? I've read that your study suggested that the taxable revenue would be somewhere around $2.9 to $3.4 million in revenue for fiscal year 2022.
Okay. So then your question is, what you want me to address the disparity between 0.3% and 2%?
Yes, sir.
The term is qualified patients. Qualified patients means that there's actual people with these ailments. Other analysts estimate it to be higher because it's a flower market. It's a faux recreational market. And there's a lot of persons, probably that would try to get licensure, though they may not be a qualified patient, and that happens. They will either fraudulate symptoms. Normally, doctors aren't giving prescriptions here in Missouri. Not typically your normal general practitioner or cancer doctors. They're not giving prescriptions. However, you have your prescription legislation written. I haven't read your legislation yet. However, that may be written, might provide a bit of an explanation of that. But I don't see any reason why that's a tremendous disparity. That's my opinion.
Okay. And then last point that I'd like to make with you before you can share with us some of your other ideas. As an economist that has studied the supply chain of cannabis, where are we most likely in our state of Alabama to incur a supply chain bottleneck? Or where have you seen supply chain bottlenecks, from cultivation to processing and finally to the dispensary?
There were states that had, early on when people were legislating, states were legislating medical marijuana. There was a lot of test legislation allowed it, and some ways that they legislated it, say in early Michigan, for example, it just stunted the market from the beginning. It really didn't ever have a chance to get to brick and mortar at that point. And it lasted for a couple of years or so until finally they basically legislated a productive piece of legislation.
Did you give examples of those?
The supply chain bottleneck probably was I can't recall that off the top of my head, but I would think that if you're going to have a supply chain bottleneck, it would be not enough demand, not enough demand early on to pick up the product that's starting to hit the shelves. You might see an oversupply at first. It's just, you'll have to see if a market will stabilize in a year or two. You just don't know once you have a brick and mortar place.
Okay.
I'm sorry. That's
No.
and I haven't read your legislation. I'll make a point of that later.
Yeah. So I want to emphasize that you stated previously that you had done research, comparative law research, regarding various states.
Yeah.
Marijuana with medical cannabis legislation. Any other?
Yes, I'll make that a point in my presentation.
Okay. Any other comments that you'd like to make for us today?
No. I was going to preface my presentation, but I'll wait till first slide.
Okay. All right. Thank you, Mr. Crater.
Yeah, I can take questions if anybody has them.
Can we have some questions?
Yes.
Any questions from the commission? I have two.
Okay.
First question, Mr. Prater. Missouri's about the same, similar population in Alabama. So how many total acres are under cultivation or cannabis to supply the demand of the market?
Oh, I don't know that offhand. I'm sorry.
Okay, the next question is if a grower has a product and is unable to sell it to a dispensary or processor, are they allowed to sell their excess product across state lines to other buyers?
No.
They are and are not.
The way it's legislated, they are not allowed to do that. No.
Dean, do you happen to know off the top of the head how many doctors you've got certified in Missouri to make recommendations to patients?
No, I haven't looked at that data. No, I haven't. I couldn't guess how many doctors have signed up to be prescribers of licenses, or not licenses, but a prescription to get a license in Missouri. I don't know that number. No, I would suspect it's in 1,000, a couple thousand, maybe. People willing to do it and that have been active doing it.
Any further questions? Mr. Crater, I thank you for your time, sir.
Yeah, okay. Okay, it's all right. Apparently I don't have a presentation. It's all right.
Okay, moving forward with Nevada Cannabis. Keoki Allen. This is Keoki Allen. Garrett Cronkite.
Yes,
Thank
hello.
you guys for your time.
We have Steve Gilbert with us as well, who's the Chief of Administration.
Good morning.
Good morning, everyone. So we decided to bring the entire team with us just in case we got some line of questioning that some of our subject experts could answer for the commission. So just giving you a brief overview of the Nevada Cannabis Program. 2000, the Nevadans voted it into to legalize medical use. 2015 was the first medical marijuana establishment open. 2016, the voters voted to approve legalizing adult use, which is our recreational program. And in 2017, our recreational program sales began in Nevada. The state cannabis program transitioned several times. It transitioned from the Division of Public and Behavioral Health to the Department of Taxation. And in 2019, our Governor Sisolak created the Nevada Cannabis Compliance Board, modeled after the Nevada Gaming Board, to then regulate the industry. In 2020, the state's cannabis program transitioned from the Department of Taxation to the Cannabis Compliance Board. Our mission here with the Nevada Cannabis Compliance Board is that we govern Nevada's cannabis industry through strict regulations of all areas of its licensing, operations, protecting public health and safety of our citizens and visitors while holding cannabis licenses to the highest ethical standards. The Nevada Cannabis Compliance Regulation consists of 14 regulations at this time. We are getting ready to add the 15th with the adding of our consumption lounges, but that was adopted by the board July 21st, 2020, and then regulations can be added, amended, or repealed upon board approval. Within the CCB, there's several divisions. We have our licensing division, our inspection and audit, investigations, and enforcement. Brief breakdown of those divisions. Our licensing division process and review licenses and renewal applications and collect fees. They manage cannabis agent registration cards. We currently have about 16,000 of those active. Those are the industry workers, and they assist the Department of Taxation in collecting unpaid taxes and fees from licensees. Our inspection and our audit division, we perform audits, spot checks, compliance investigations regularly. We do an audit and inspection annually, which is required within our regulations. We track and monitor all inventory from seed to sale and audit monthly and quarterly reports from licensees, and that is required by the CCB. Our investigations unit review and process all transfer of interest for change of ownership requests. They vet potential licensees and affiliated owners, officers, and board members, which include a full suite of background checks and financial analysis as a part of a required suitability review. In our enforcement division, they evaluate all complaints made against licensed facilities, including incident reports, and they partner with local and state law enforcement regarding criminal investigations, including enforcement on illicit market. We currently have 5 types of facilities. Again, we're going to be adding our 6 very soon. Right now we have cultivation, production, retail dispensary, testing labs, and distribution. Of course, cultivation, those are our growers, and they sell to cannabis establishments and not to consumers directly. Production is licensed to purchase cannabis from the manufacturer, process, package cannabis products, and to sell to other cannabis establishments, but not to consumers. Our retail dispensaries, of course, is licensed to purchase cannabis products from the cultivation or the production, and they are the only ones that can sell to a consumer. Our testing labs, they test all cannabis and cannabis products, and the distributors, they're licensed to transport cannabis from one cannabis establishment to the other. Currently, we have a total medical and recreational operational licenses statewide is 761. That's as of March 2022. And we currently have a breakdown of those licenses there for you. Right now, we have 158 cultivation facilities, medical cultivation facilities, 112, production medical facilities, 10 independent labs, and 66 medical cannabis dispensary. Just to make a note that the total statewide licensing is 761. There are several of these. I think there's an estimated of a little bit over 350 dual licenses, which means that they have both medical and recreational licenses in Nevada. In addition to that, we do allow vertical integration. So there are several of our licensees that are vertically integrated, meaning that they are owned and operated by the same entity. And that means that they own the cultivation, a production, a dispensary, and a licenses basically support the consumers, and they would then transfer that information to the testing labs, as well as the standalone operations as well. As I conveyed earlier, as of lately into 2021, AB 341 approved us to the addition of cannabis consumption lounges. It authorized the CCB to license and regulate the cannabis consumption lounges. And this basically just gives you an overview of the retail dispensaries may apply to open for one retail lounge per license. And then there will be 20 independent lounges, 10 of which designated for social equity applicants. And that's just an overview of the fee for those licenses. You can go to the next slide. Now, we also allow delivery of cannabis to our consumers. If you can take a look at this slide, you would notice that in 2021, they were very low of vehicles that were approved for delivery. All of our cultivators, dispensaries, production facilities that have a transporter's license tethered to their establishment licenses are required to maintain specific criteria for the vehicles. They must, each vehicle driver must have a work card to drive the facility. They are required to go through a vehicle inspection with our agency to make sure that they have proper refrigeration and security and cameras on those facilities for deliveries. And so this counting briefly gives you an outline of our delivery requirements in Nevada. And also on this slide, you can also see the uptick in 2020 when COVID started and a lot of our establishments were not able to do in-person transactions, that there was a very large uptick of vehicles being added to the road to accommodate those sales. Our inventory control system. The CCB tracks all cannabis and cannabis products from acquisition of seeds and immature plants to patient and customer sales through metric. We have a regulatory requirement that all establishments must utilize the seed to sale inventory tracking system designated by the board. All establishments must document and report any reductions or destruction of cannabis and cannabis products. And all establishments must maintain acquisition, transfer, and or sales records for a minimum of 5 years. Currently, our inventory control system is metric. We have used them since at the end of 2017. They've been our partner in this industry since then. And we haven't had any real issues with them up to this point. They've been a great partner. And so this is what we use to track our inventory. We track everything from, the seeds coming in, any donations, any external transfers coming in, transfers to and from our cannabis establishments. We track everything from the adjustments that they make, the reasons why they're making the adjustments, any activity that may look like that they are adding product into the system non-compliantly. We're able to identify that through our data analysis within the information being provided into and out of metric. And then that's the summary of our presentation. We wanted to open it up to you for any questions that you may have for us.
One question, Ms. Allen. Are out-of-state tourists allowed to buy any of the products? Or do you have to have a Nevada driver's license in order to purchase the products?
I'm sorry, I can barely hear you, but I'm going to assume that your question was that can out-of-state tourists purchase?
Can non-Nevada residents buy the product when they're visiting in your state?
Correct. Yes, they can. We offer both medical and recreational products in the state.
So the only requirement is 21 years of age or older.
As long as they're 21 years and older, yes.
Thank you.
I have a question, Ms. Allen.
Sure.
Can you briefly describe the educational requirements for dispensary staff? And are there felony charges that the state can file against dispensary staff for the diversion of cannabis?
I'm gonna allow Kara to answer the educational part for the dispensaries. As far as the felony charges, we have a team of DACs that work in our office, literally in our office. I believe we have 3 on site. We do file complaints against individual agent card workers because they are required to have a full understanding of our regulations and the regulatory requirements on each level. And so it's not only in dispensaries, it's in the cultivation, production, the drivers, our testing facilities. The individual worker may have a complaint filed against them for any diversion activity, anything illegal going on in that facility that they initiated or were a participant in.
Yeah, and as far as training, we do require that each facility has a security manager on site, and they have different requirements for training. They have to be trained on availability of different strains of cannabis, the effects of different strains, inventory control. So the consumer education would have to have all the strain information, effectiveness of methods, forms, and routes of administration, prohibition of smoking and cannabis in public, education on how it impairs the ability to operate a vehicle, possession limits. There's quite a few different training requirements for different facility types, but the ones for dispensaries focus mostly on facility and product security, as well as consumer education. Theft prevention, emergency response, first aid, and control of access. So our NCCRs, our regulations are NCCR 6.085 that covers all the training that's required for agents.
Can you describe a typical red flag that would alert your department of suspected cannabis diversion? Like for Mrs. Allen, what would you normally see that will flag your attention to say, hey, something's not right?
So in our C2L inventory system, we look heavily upon adjustments, and adjustments going up in a package or going out of a package is always suspicious to us, especially after testing. We do know that when you guys are when the industry is harvesting or producing something that entering something into the system, and there may be a fat finger, errors do happen. But typically, once the product is tested, that product should be validated, meaning that it should have been weighed and confirmed by 2 people that was the weight or the units in that package. And so when it gets tested and we see product, an adjustment going up saying, hey, well, you know what, we forgot, it wasn't 5,000, it was 5,500. And it's like, yeah, no, you have to tell me where that comes from. Or we see product just mysteriously leaving a package, and they adjust it out and they may say entry error, or they also may say it's simply they don't know where it came from, or unknown source, or and typically when we start to dig in that, someone usually tells on someone, and then it kind of launches into an investigation. So we typically heavily use our seed to sell system and notifications of abnormal transactions happening within the system to determine if something needs to be looked into a lot further. And then also we require them to submit their quarterly reports and conduct two-person physical inventories once a quarter and report any variances that's found to the department as soon as they recognize that there are major variances in their inventory, and then our investigators and our auditors then start digging into that for more explanation of what happened in those scenarios.
And this is Kara Cronkite. I can add to that just a little as well. On the production side, what we will see occasionally is that they'll have so many pounds of oil, and we would anticipate that they would be able to make let's say 5,000 packages based on that amount of oil, and we're seeing they're only making 3,000 or 4,000. And so it'll be a lot less than what we would anticipate they could create with that weight. So that's another thing that is a red flag for us as well.
Yeah. I was reviewing your law, and in the law it stated that you guys could charge the licensee for the audit. Has that been beneficial for the state, charging a fee to these licensees when you have to audit them?
Yeah, I can talk about that. So we are fee funded completely. We don't use taxpayer money. Any money that we don't use goes to schools for education. So we bill for our time. We call it time and effort billing. Anytime that we go out and do an inspection or an audit, or we're running investigations on them, we bill for the time that it takes our staff to do that work. Sometimes it can take, we've had investigations that went on for months, and their bills can rack up to several tens of thousands of dollars. So it has been beneficial to the state. We also issue civil penalty fees. So if they get, if they're observed being non-compliant with our regulations and they're in violation, we will issue penalty fees for those as well. And if they're severe enough, they also can get into the hundreds of thousands of dollars. And our highest one was $1 million. And so they do generate a lot of income that supports our entire program.
I think my last question, I saw that you guys generated around $50 million of revenue in 2020 for the state. How many audit specialists and inspectors do you guys have on staff to ensure this big operation can continue?
So I would say that we could always use more staff. We are currently at, I believe, 12 inspectors statewide, and Keoki, correct me if I'm wrong, but I think 10 auditors statewide.
We're at 11 auditors with one coming on board.
Yeah.
So we'll be at 2.
Yeah, and then we have supervisors over each program. We have a team of 4 laboratory inspectors and a laboratory supervisor as well, and they're responsible only for inspecting the laboratories because they are the gatekeepers of the industry. If they're not doing their part correctly, then it all kind of falls apart. And then we have several support staff. We have 4 post officers who do the law enforcement side for us, and I believe we have about 8 or 10 investigators that do the background checks on the owners to make sure that they're suitable to work in this industry.
So in total, what do you have, about 70 employees for the state?
And once we're fully staffed, we'll be at 93, I believe. And I would say that's still very low.
You guys have any questions?
Okay. Ms. Allen, this may be directed to you possibly. When you're pricing the medical cannabis products versus the recreational products, is there any difference in taxing of either product, or is it all the same?
The taxing structure is different. So medical product, they do not get assessed the the 10% excise tax. Whereas recreational, non-medical patients, they do get assessed a 10% excise tax on their transactions.
Thank you, ma'am.
You're welcome.
Any other questions of the commission? That completes your report.
Yes, sir. Thank you, Mrs. Allen and Mrs. Cronkite, for your help today. You guys have always offered me great advice, and I appreciate your help.
Thank you.
Thank you. Next on the agenda is the physicians committee report by Dr. Felicity.
Thank you. I appreciate that. Our committee, to include Jersey and Angela, have been working on our rollout for our structure for patient and caregivers. And we are about half to 3/4 of the way finished. We're still re-reviewing that, but I think it's coming along quite well. Angela's on, she's nodding. And Jersey was on, I don't see him, but
I'm here.
there you are. Basically what we're doing is we're looking to Jersey and asking and answering questions, and he's bringing us along slowly. But we are moving along, and should have some more answers for you by the next committee. Jersey,
just one comment, if I may. I reached out to some colleagues in states where they're practicing medical cannabis regarding how they recommend it, just to clarify some of the issues that we discussed last time.
Yeah, as Jersey pointed out, one of our kind of sticking points was about how to dispense, or how, and I don't want to use that word because Jersey gets kind of, but we're not prescribing, and we'll talk more about that when we present our findings. So thank you.
You know, just one question I have, with certifying physicians and a variety of diagnoses. If you're a primary care doctor, will you require some type of documentation by a specialist, perhaps? They're saying they have Parkinsonism or whatever. Will they require an evaluation by a neurologist to confirm that diagnosis before you can certify them with that diagnosis?
Jersey?
I'm sorry, can you repeat that question? Because I barely can hear it.
As for the certifying physician, you will certify a patient with a diagnosis that qualifies for medical marijuana. Will you require a specialist? For example, if someone has Parkinsonism and medical marijuana is felt to be of benefit, will you require, say, a neurologist to render an opinion, or can a primary care physician certify that patient without a neurologist evaluation?
The requirement of the Alabama BME is that only specialists who handle these patients within their scope of the practice can recommend a medical cannabis for these patients. So if this is a Parkinson's patient and they're managed typically by neurologists, it will have to be a neurologist who recommends medical cannabis. So I suspect that there will be physicians in 3 groups: internal medicine or internal medicine specialties that will handle the internal medicine recommendations like Crohn's disease. There will be psychiatrists who will be managing things like depression or autism, and the same will be for neurology like Parkinson's or multiple sclerosis or epilepsy.
Okay. Any other questions from you? Thank you. Does that complete the report, Dr. Felicity?
It does. Thank you.
Thank you for your hard work. Next will be an agricultural report by Rex Hall. Rex?
Thank you, Dr. Stokes. Our agricultural committee met last week, and I'm going to let one of our committee members, Mr. James Harwell, elaborate a little bit on that.
Thank you. Appreciate that. I want to read a report from Patrick Moody, which is Deputy Commissioner of the Department of Ag and Industry. Patrick could not be with us today, but I want to thank him and Commissioner Rick Pate for their work, working with the committee of Ag and Industry over the last few weeks. Let me just read a report from Mr. Patrick Moody. It says the Alabama Department of Agriculture and Industry plans to publish the draft cultivator rules in the next couple of weeks of May. And those rules will be brought before the Ag Board for consideration on Tuesday, July the 12th at 10 o'clock. at the Department of Ag and Industry auditorium. And once we publish these rules, they will be on the website of the Alabama Department of Ag and Industry. That is a report from Deputy Commissioner Patrick Moody.
Thank you, James. I think that the actual dates could be of June. I think the month of June, public comment would be available to be made, maybe up to early July before the next ag and industry board meeting. But at that time, if everything is in order, we will move forward and that board will approve our rules for cultivation.
Let me ask a question. What if public season there are several concerns or suggestions for changing? Would they bring those to you on the 12th of July, or do they need to make those known to you prior to that meeting?
They'll be making those known to the board ahead of time.
Like that.
Prior to that meeting.
So then you would take up those concerns or issues at that meeting, correct?
Exactly.
Okay, thank you.
Anybody else got any questions on
Those should be published by end of May on their website.
You should have the whole month of June and early part of July to comment before that next board meeting, and that board will take those and give us direction from their rules.
Recommendations back to us.
Yes.
That completes your report.
Yes.
Next one will be the processors committee report. Dr. Jensen.
Dr. Stokes. Our committee has been working through the workshops on establishing rules for applications and licensing of processors. That process is getting near completion. And then our next upcoming workshop will be state testing laboratory. I think that one's going to be a little more complex than the last one, but we'll see.
Do you have like a timeline when you think you'll be available to put these final rules and regulations available? People can review them and then give comments back to you this summer.
This summer. I'll go with them.
We got a timeline on that. But it'll be this summer, yes. It'll be sometime this summer. Yes.
Our report.
Thank you, Dr. Jensen. Next will be a report from law enforcement. Mr. Dion Robinson.
Thank you, Chairman Stokes. On behalf of the Law Enforcement and Legal Committee, we've been working the same thing as far as the workshops have been going back and forth. Today I have the pleasure to have with me one of the senior counsels from ALEA. He's been working hand in hand with the commission as well as myself on rules and regulations, safety, and road hazards. I think today you want to touch on a couple of topics.
Thanks, Dion. Basically, there is the oldest law enforcement agency in the state of Alabama. Maybe not necessarily the oldest incorporated law enforcement entity, but as far as the state goes, we have been helping this newly minted law enforcement agency to go through some of these growing pains that they're obviously going to have to be going through for several years to come. But our assistance so far has been advising license issues regarding when a particular person needs to be, their driving privilege needs to be evaluated. We've also been working with the transporters, and helping to develop rules regarding licensing the transporters as well as licensing the drivers that work for those transporters. We've been applying principles that we've had in place for years regarding certified drivers of record and other companies like that we regulate. And that's pretty much in a nutshell what we've been working on. We've also started working on the inspection side of the dispensary. We worked a little bit here recently regarding security and safety for the dispensaries as well. That sums it up.
I wanted to be noted that our main concern is the safety of each and every form from seed to sale. So that's our focal point from looking at cameras and the areas of which each facility will be located. So just trying to get everything into place.
Isn't there a maximum of milligrams per day that surrender the license to 75? Milligrams
Yes,
a
sir.
day?
Yes, sir.
We can give up to 100, but they're over 75.
75.
They should give up their license.
That's correct.
Yes,
You
sir.
don't look at the interaction. A lot of people have other coexisting comorbid conditions of the interaction of things like gabapentin, or if they're on pain medicines along with medical marijuana. Are y'all gonna look at something to maybe lower that limit, or
I don't think the limit will be lower. I think it's already a
about the
set
interaction
standard.
of those drugs?
Yes, sir. There's a set standard, the 75 milligrams. Now, I don't believe anyone has entertained looking at whether or not to lower that limit.
Maybe we should ask that to our medical committee, Bill Zielinski. They think that's something we need to look at it, because everybody here is gonna have comorbid conditions. They're gonna be on other medications probably. Always have to worry about the interaction of meds.
Yes, sir.
Let's Bill, what he thinks about Zielinski. Okay.
There are clearly interactions between cannabinoids and other medications. They need to be handled on an individual basis because the interactions vary depending on which cannabinoids you talked about and which prescription medication you talked about. So it's hard to create rules if each patient will need to be handled very differently and on an individual basis.
Well, do you think you should kick it back down to the certifying physician? That physician should be responsible for evaluating the patient and other medications they're taking.
I believe that it's the responsibility of the certifying physician to review the medications and make sure that that they discuss all possible risks and benefits with the patient, including the interactions.
Okay. Thank you, Bill.
Go ahead. He said that he thinks that it should happen with the physician.
But I think probably needs to put that in the
Okay.
regulations they're looking at, that certifying physician is like certifying that the patient's not pregnant.
Right.
I mean, they gotta certify that, and then maybe they should be responsible for looking at the other medicines they're taking. Maybe they don't need 75 milligrams, maybe they drop them down to 50 if they're taking a lot of pain medicines or other things that can affect your.
Hey, yeah, I agree with you, mainly because it has to happen upstream with them, because it can't happen in the
Can't show up in the pharmacy, can't be obligated to do that.
Well, yeah, I mean, and yeah, that goes into a whole nother
Okay,
thing.
well,
Yeah.
we'll just be sure that's in the certifying physician's responsibility. Any other?
So ball a lot of my court on that.
Thank you so much. Any other questions? Next, then we'll move on to budget committee report.
Thank you, Mr. Chairman. A copy of the budget is included in today's handouts, and I would like to note that the budget today shows the supplemental appropriations that were approved, and they have been added. All the report on.
Okay, so everything's in line. Thank you, Mark. Any other questions of Mr. Gamble? If not, then we'll move on to our staff reports. Mr. Miller.
Okay, I've just got a couple of things. One, I want to say to the members of the commission and to let our guests know that these committees have really been doing a great job. They have really been working. Our attorney, Will Webster, has been participating with them, and to thank the members of the commission for that work, and to let our guests know that it's going very well, and these folks have really been committed to putting these rules and regulations together. And the other thing, had a call from young Boozer just before I came down here. He is chairman now of the National Association of State Treasurers Banking Committee, and their total focus, for the most part, is on getting safe banking legislation passed. And he feels pretty good about the direction it's going, and just wanted to assure us that it really is a high priority for his committee. That's all I have, Mr. Chairman. We'll let Mr. Archer take over from there.
Okay, I'd like to just a couple more comments about John, about the rules and regs, the workshops, and they're on the slide, so you can see the work sessions that we've already had. We've had 6 of those, and again, they've gone very well. We've got a lot of information. I know we've had a lot of interest from the public, viewing these. I know the public has wanted to make comments on these, but we appreciate their withholding, and there'll be an opportunity to do that during the public comment stage. We've got 2 more workshops remaining. That's next week, the 18th, and then on Friday, the 20th, the 18th, dealing with applications and licensing on the laboratories, state laboratories, and then for integrators on Friday, the 20th at 1 o'clock. The other item I wanted to mention, also in regard to rules and regs, I have the tentative, timeline for our rules and regs, and that's it's also in your packets, I believe, members. Unless we do some type of emergency effort on our rules, which we don't plan to do at this point, this is as good as we can do in terms of our timeline. So we've got the June 21 timeline, where by that time the commission must submit rules to Legislative Services Agency for publication. Then about 9 days later, the Legislative Services Agency will publish that draft, and we'll begin the 35-day public comment period. So that public comment period will go from June 30th through the month of July, and that will end, I believe, August the 5th, which I think is a Friday. About a week later, our commission meets, and at that August commission meeting, the commission will adopt the rules as published or as amended. And at that point, on the 19th, we will submit those adopted rules to the Legislative Services Agency for publication. And on the 31st of August, the adopted rules will be published. We'll begin a 45-day period where, again, it's subject to challenge, and barring none, October 17th will be the effective date for our rules. And so that's what our timeline looks like. And again, that's assuming nothing goes wrong, and that's a track wrong. And I feel good about it. That's my report.
Any questions?
I would like to say I appreciate members of this commission for your participation. All of you have participated, offered valuable comments, and again, I know we started with subcommittees focusing on these, but again, we invite each of you to be a part of these next two work sessions. Thank you.
Go ahead with Brittany's report.
Sure. I just wanted to give an update on the seed to sale RFP. In your packet, you have a timeline. And again, just as Daniel mentioned, it's kind of tentative. These are the dates that we have as goals. Of course, anything can happen in the meantime. But we're about halfway through the process. The RFP was released in March. We did a question and answer period where potential vendors could ask any questions or clarifications of the RFP. We took those, responded, and posted them on the website. They've had until April 22nd to submit proposals. We've been sorting through those, making sure all documents are included. They've been shared with the evaluation committee, so they're working on those, and hope we can have a recommendation sometime in mid-June. That concludes my report.
Yeah, that's it.
The next item is item 14. That's a decision by the full commission, and that was for issuance of request for proposal for patient and caregiver registry. Basically, if the commission agrees, we will authorize our executive director, Mr. Bill, and his staff to move forward with proposals for an RFP for caregiver registries, patient and caregiver registry. So we need a motion, and then we'll have discussion.
Dr. Stokes, I'll make that motion that we issue the request for an RFP.
You have a second? So, any discussion on the situation? Comments? Not, then all in favor say aye.
Aye.
Those like sign? Ayes have it. No business, any contention?
We don't have any.
Any new business? Not, then our next meeting will be June 9th, 1 o'clock, invite everyone to participate. Please, get a motion to adjourn.
The motion.
All in favor say aye.
Aye.
Ayes have it. We'll see y'all in June. Thank y'all. Good report, very short.
Yes.
Laura,
Okay, guys, so I recorded everything, and I will go back and watch it and make notes as I need to, either this evening or tomorrow, and I'll get that put up on the page, both the pages and the groups, and I'll also throw it up on the website. The next meeting is next Wednesday. That's the 18th. And the focus of that's a specialty meeting, and the focus will be state testing laboratories. I'm getting ready to launch the membership campaign, and so we got a lot of things coming, and a lot of the content right now is the commission and getting the law implemented as we need to. So just be on the lookout for all that, and I'll throw it up on the both the pages and the groups and the website. Also, please remember anybody that has any questions or concerns or anything like that, you can shoot me an email, or you can message the page, or you can message my personal Facebook page. However, is easiest for you. Okay. So y'all have a good rest of your day, and we'll talk later.